Today we're going to be talking about safer sex. I'm Elizabeth Bricker and I'm a BroncoFit Peer Health Educator. So when we're talking about safer sex and kind of the importance and the benefits of safer sex, what we're really talking about is working to minimize our risk of STIs, preventing unplanned pregnancies, and both of these things combined help us to invest in our health and the health of our partners right now and in the future. And when we're talking about safer sex, we're hopefully starting conversations that will build trust and respect between ourselves and our partner or partners. And the way that we can accomplish having safer sex is by using barrier methods and hormonal methods. And barrier methods prevent a sperm and an egg from meeting or from skin-to-skin contact from occurring, and this can cause the transmission of STIs. Barrier methods are physical barrier, and this includes internal condoms, external condoms, and dental dams. And then additionally, hormonal methods or contraceptive methods help us to prevent against unplanned pregnancies, not STIs. And this accomplishes that by preventing ovulation through the thickening of cervical mucus, by introducing synthetic hormones into your body. And we'll talk about the different ways that we can use hormonal methods and the different options that we have a little bit later on. So we're often familiar with what STDs are, but what exactly are STIs and what's the difference between those two? So STI stands for sexually transmitted infection, and these can be transmitted through different sexual activity, and this can be oral, anal, or vaginal. Or additionally, skin-to-skin contact or exchanging bodily fluids can also transmit STIs, and it's really important to know that and be aware of that. And some of the different STIs, just a few examples, include chlamydia, gonorrhea, and HPV. And it's important that we know that not all sexually transmitted infections will turn into a sexually transmitted disease, and that's why we make the distinction between the two. And we also know that the best way to prevent against STIs is through using barrier methods such as condoms. It's also important that we get regularly tested. It's recommended that you get tested annually and discuss your risks with your doctor. People can be unaware that they even have STIs and be passing them along unknowingly to their sexual partners. So be sure to have those conversations with both your doctor and your partner prior to engaging in sexual activity. There are actually some testing options available near you. Boise State University Health Services is an option, and you can call this number below to make an appointment with them. Planned Parenthood also has options, and you can call that number or book appointments on their website. Central District Health is providing free STI testing in the month of December of 2020. And when we're outside of December, you can go ahead and call them and make an appointment, and you can pay using sliding scale or flexible payment options if you're uninsured. So the different barrier method options that we have are external condoms, internal condoms, and dental dams. So these are our different options. There's not too many to choose from. And these help to protect us against STDs and STIs and unplanned pregnancies, though it's important to note that dental dams do not protect against pregnancy. For best use of internal condoms, to make them the most effective that they can be, we want to make sure we're not using expired condoms, that we're storing our condoms correctly, that they haven't been ripped or torn ahead of time, and that we are always using water-based lubricant when we are using condoms. This helps to make them more effective. So if we can remember to be doing these things, that would be great in helping us to make sure our condom use is effective. And then additionally, if you're not sure how to use condoms, that is okay. Practice makes perfect. You can go ahead and Google it. There's lots of great diagrams that kind of help you to understand how to do it. If you're curious about how to take off a condom correctly or what to do if a condom breaks, you can go ahead and pause on this slide. Just additionally helping make sure that we are using condoms correctly. Internal condoms cover the inside of your vagina, and they can protect against both pregnancy and STIs, just like external condoms. And these are 79% effective. So as I mentioned, there's a couple different birth control or hormonal method options that can be considered. So firstly, there's emergency contraceptives. This is known as the morning after pill. Plan B One Step is a brand of emergency contraceptives. And they're most effective if they're taken within 3 days after having sex. They're more effective the sooner they're taken. They are, however, expensive. They can be up to $50. You can call your local Planned Parenthood and see if they offer an option near you to have it paid for. There are weight limits. Once you get up to 155 pounds, this is a less effective option. So that's important to note. But it doesn't require a prescription like the other birth control or hormonal method options, so you can get it at your local pharmacy or drugstore. Oral contraceptives are what we know as the pill, help to prevent against ovulation. All these different methods use a combination of estrogen or progesterone. The thing about the pill is you do have to take it every single day at the same time to make sure it's as effective as it can be. And so how effective it is really varies on the user. Next, we have the ring, and it needs to be replaced monthly. It's 99.7% effective. Next, we have the Depo-Provera shot, which you can get every 3 months or 4 times a year, and this is 96% effective. And then we have some things that get inserted into us, such as the Implanon, Nexplanon, and the IUD. These are the most effective form of birth control. Copper IUD or hormonal IUD, these are longer lasting forms of birth control, and that can actually be used as emergency contraception. Some lesser known methods include the diaphragm and the birth control patch, and these are also not as effective as the other methods that we talked about. So when you're trying to decide what's best for you, it's really important that before you're having sex that you're having conversations with both your primary care provider and your partners. And that's really the best way that we can kind of kick off having safer sex. You want to be talking about what safety looks like for you and your partner, if either of you have been tested, and what your different risks are. It's important to decide what's most important to you. Is it preventing pregnancy? Is it preventing STIs? Have you talked with your doctor before? It's important to talk about what makes you most comfortable and what your partner's most comfortable with. Boise State University Health Services does have some options to provide, manage, or prescribe oral contraception or contraceptives such as the pill, the Depo-Provera shot, intrauterine device or IUD, Nexplanon, and they'll also fit you for a diaphragm and provide you with free condoms. They also have emergency contraception and test for STIs and treat STIs and test for exposure. Pregnancy tests are also available. You can call health services, and they're located on the second floor of the Norco building. Talking about some resources, there's a spot-on period tracker from Planned Parenthood that reminds you to refill your prescriptions and checks in with you to make sure you're using them most effectively. Again, that's how we can make our birth control methods the most effective, is by using them correctly. If you're kind of struggling with all these different options and feeling overwhelmed by them, that's totally understandable. Planned Parenthood has a great quiz that you can take to try to figure out which birth control method is best for you and is right for you. You can take that quiz to help you figure that out and navigate through the different things that are important to you and that you value. Graphics are also super helpful. You can just Google different birth control methods, different contraceptive devices to try to figure out what is most affordable for me, which method would work the best, what am I kind of compatible with based on my values and needs. You can go ahead and pause on this slide if you really are wanting to focus on this piece of information. So it's just important that you, before you're having sex, that you're starting those conversations with your doctor and with your partners. Ultimately, your future is up to you, and you're the only one that can work to protect it. Lastly, I just hope that you are healthy and that you're safe.